All right, let's talk about something that affects every single one of us, every day, but often feels, well, completely impenetrable. I'm talking about health policy. Today, we're going to crack open that black box and figure out how these massive, life-changing decisions actually get made.
I mean, have you ever found yourself scratching your head, wondering why some super obvious health solution takes decades to become official policy? Or, why one health crisis gets wall-to-wall media coverage 24/7, while another one that's just as serious barely makes a peep? It's confusing, right? And honestly, it can be really frustrating.
Yeah. From the outside looking in, the whole thing can seem like a giant, tangled puzzle with a ton of hidden pieces. Decisions get made, policies are launched, but the how and the why of it all? That stays pretty murky. We see the final picture, but we never see how all the pieces were put together.
But what if I told you there's a tool for that? A kind of decoder ring that experts use to make sense of all that chaos. A way to see all the moving parts and understand how they connect to each other. Well, guess what? There is. It's called the Health Policy Triangle. Now, this isn't some brand new idea. It was actually developed way back in 1994 by two researchers, Walt and Gill. But man, is it powerful. Think of it like a special lens that helps you analyze pretty much any health policy in any country just by focusing on three essential corners: the actors, the context, and the process. Let's break down what each of those means.
First up, we've got the actors. Simple enough, right? These are all the individuals, the groups, the organizations, basically anyone and everyone who's trying to influence these decisions. They're the players in the game.
Second, there's the context. Because let's be real, none of this happens in a vacuum. The context is the world that these players are operating in, the whole political, economic, and social landscape that sets the rules and determines what's even possible. And third, we have the process. This is the how. It's all about how these decisions are actually made. The steps, the negotiations, the arguments, the whole journey an idea takes to become reality. So got it? Actors, context, and process. That's our triangle. Okay, let's dive into this a little deeper, starting with that first corner of our triangle, the actors.
Now, the first thing you have to get out of your head is the idea that policy is just made by politicians in suits. That is so not the case. The stage is way, way more crowded than you probably think.
And just look at the variety of players here. It's a real web of influence. Of course, you've got governments at the center, but they're getting pushed and pulled by everybody else. You've got huge international bodies like the World Health Organization, massive private companies with their own interests, university researchers bringing the data, powerful lobby groups, and of course, the media, which shapes what we all think about it. Every single one of them brings their own agenda and their own power to the table.
So, let's move on to the second corner of the triangle. This whole cast of characters doesn't just operate in thin air. The context is the world, the environment that all of this happens in.
And you can really break context down into two different kinds. On the one hand, you have situational factors. I like to think of these as the sudden storms. A brand new epidemic, a natural disaster, something that just explodes onto the scene and forces everyone to pay attention. But then you have the structural factors. These are more like the deep ocean currents, the slow-moving, powerful forces like a country's political system, its economic health, its demographics. These things define the absolute boundaries of what's even on the table for policymakers.
Okay, so we have the players, and we have the stage they're playing on. Now let's look at the final piece, which is kind of like the script they're all following, or more often than not, improvising from. This is the process. So, we can think about the process as a cycle with four main stages. First, you've got to get a problem on the agenda. Then, you formulate the actual policy. After that comes the really crucial and often forgotten stage of implementation, actually doing the thing. And finally, evaluation, to see if it even worked. Now, this all looks like a nice, neat circle, but let me tell you, in the real world, it's a total mess. It's a looping, chaotic cycle where stages get skipped, repeated, or just plain stuck for years.
So that's the framework: actors, context, and process. It's a neat theory, right? But its real power, its real magic, comes when we use it to solve a real-world policy mystery.
So let's look at the tragic case of what used to be called cot death, or sudden infant death syndrome. For years, years, the research was clear. Having babies sleep on their backs could save thousands of lives. The evidence was overwhelming. And yet, for a long, long time, nothing changed. Why?
The health policy triangle helps us figure out exactly what happened. The core issue here was the context. A slow, steady rise in deaths, as tragic as it is, just isn't a focusing event like an earthquake.
It doesn't scream from the headlines, so it doesn't demand immediate political action. It was only when key actors like nonprofits in the media stepped in and created their own focusing event with powerful TV programs and campaigns that things finally started to move. That huge public pressure is what it took to kickstart the process, forcing the problem onto the government's agenda and finally leading to those life-saving public health campaigns.
And this is exactly why this framework is so powerful. It isn't just some dusty thing for academics. It's a new lens for you to see the world with.
So here's the bottom line. With this simple triangle, you're empowered. You can look right past the shouting on the news and start to see the hidden machinery working underneath. You can ask the right questions and actually start to understand why some great ideas take flight while others never get off the ground. So the next time you see a major health story break, don't just see the problem. Use your new tool. Ask yourself, who are the key actors here? Who's pushing? Who's pulling? What's the context? Are we in a sudden storm, or are there deeper currents at play? And where are we in the policy process? When you can start to answer those questions, you're no longer just an observer. You're an analyst. You can see the whole picture.